So let's start. So migraine produces headache of varying severity associated with nausea, vomiting, photophobia, visual disturbances, scalp tenderness, vertigo. There may be other severe syndromes. ঠিক আছে? These are the major symptoms of the migraine. তুই লাস্টে ওখানে গিয়ে কি করছিস? এখানে এখানে ঠিক আছে, that are the symptoms. What is scalp? Scalp, the tenderness. The tenderness. Does anybody have migraine? Or আছে? তিনজনের। So typically there are triggers for migraine like glare, light, some sound, stress, hunger, exercise, exhaustion. These things typically triggers migraine. কি গরম লাগছে? ঠিক আছে, there is a trigger for migraine. তোর নাম কি রে? তোর নাম কি? জয়িতা। তুই আগে কোনোদিন এসেছিলি? Even hormonal change that during menstruation can trigger migraine. So phases of migraine. Prodromal phase. Prodromal means before there is a attack, there are some signs and symptoms like yawning, tiredness, mood changes, neck discomfort. এই এটা বন্ধ করে দিয়ে, দরজাটা বন্ধ করে দিয়ে। Then that is followed by headache phase. So it may be associated with nausea, photophobia, phonophobia. ঠিক আছে, headache may be of severe degree. Photo means light, phono means sound. ঠিক আছে, then there is postdrome. Postdrome characterized by tiredness, weariness, lack of concentration. So mediators of migraine. So calcitonin gene related peptide is the most important mediator of migraine. There are other inflammatory mediators. Sajda bhai diya hai. There may be other inflammatory mediators like substance P. There may be prostaglandin derivatives that may cause, that may produce this migraine. Then dopamine receptors are supposed to be involved in it. Nobody actually know what causes migraine, there are various postulates. Then 5-HT receptor, important for our pharmacological view. So, typically the trigeminal nerve, it causes release of certain substances like calcitonin G reactive protein. ঠিক আছে? So these substances CGRP, they cause dilatation of blood vessels. So anything that causes dilatation of blood vessels is associated with headache. What are the medications that cause dilatation of blood vessel? Nitrate. Nitroprusside. ঠিক আছে? These causes dilatation of blood vessels in the brain that leads to this headache. Then the trigeminal nerve stimulates the trigeminal centers. This causes hyperpolarization of the cortex. That causes the pain sensation. ঠিক আছে? There is dilatation of blood vessels and hyperpolarization of the cortex. There is this swelling of blood vessels. So what should be the treatment? Triptan তো দিনে বলছিস। constriction of blood vessel. অভিজ্ঞ দিকে ঠিক আছে? So types of migraine: classical migraine, migraine with aura. Typically before the starting of the migraine there will be visualization of aura. Aura মানে not exactly dreams. ঠিক আছে? ঠিক আছে? There will be visualization of aura. So before the patient has this migraine attack of migraine, he or she becomes alert that there is going to be an attack. Present only 20% of the cases. Then there is the common migraine without aura. That is the maximum cases. 80% of the cases without the aura. Then there is chronic migraine. Chronic migraine, more than 15 attacks per month for 3 months in a row. ঠিক আছে? That is known as chronic migraine. So migraine treatment, one, that is you need to abort the acute attack, and then there is prophylaxis. Prophylaxis means prevention of attack. ঠিক আছে? So we come to the drug for acute attack. Triptans, the most important drug, comes as a short note, also comes as explain why. ঠিক আছে? Ergot alkaloids. Ergot alkaloids were the first drug to be used. Ergot alkaloids পড়ানো হয়েছে তো? হয়েছে? হবে ergot alkaloid. Then NSAIDs. NSAIDs is non-steroidal anti-inflammatory drug. Since there are inflammatory mediators in the brain, so NSAIDs are useful. Then D2 receptor blocker, these are adjuvant drug. ঠিক আছে? In addition, some new drug has been discovered. Now we come to the Triptans. Sumatriptan is the most important drug widely used for termination of acute attack. ঠিক আছে? Then there is Amitriptyline, Amitriptyline, Natriptyline, Zolmitriptan. Okay. So mechanism of action. These drugs are agonists at 5-HT1B, 1D. 5-HT1B, 1D. What are other 5-HT receptor? One third. বল 5-HT3 রিসেপ্টরের কিছু নাম বল, মানে ড্রাগস অ্যাক্টিং অন অন রেসেপ্টর। ঠিক আছে, বলেছে। So then blocks trigeminal nerve transmission. So the trigeminal nerve causes the triggering of the migraine. Constrict dilated extracranial blood vessels. Suppress inflammation. So let's look how it works. So this is the nerve terminal. So 5-HT1D receptor is a preganglionic receptor. Any agonist acting on 5-HT1D prevent release of neurotransmitter. By neurotransmitter CGRP. ঠিক আছে? So 5-HT1D receptor stimulation leads to prevention of release of CGRP. And then there is 5-HT1B receptor. So stimulation of 5-HT1B receptor leads to vasoconstriction. ঠিক আছে? Prevent release of neurotransmitter and causing vasoconstriction. That is the mechanism of action of triptan. In recent time, CGRP receptor agonist has also been approved. ঠিক আছে? GPANT, these drugs are known by GPANT. ঠিক আছে? শুনেছিস? GPANTs. So these have been recently approved for blocking the receptor, CGRP receptor. Remigepant. ঠিক আছে? New drug that has been approved. Some monoclonal antibodies has also been approved. Monoclonal antibody, what is that? শুনেছিস? নাম শুনেছিস? Have you heard of this term, monoclonal antibody? না, ঠিক আছে। So ADR. So this causes vasoconstriction. So in case of coronary vasospasm, you must be careful. কি হবে coronary vasospasm হলো? Ischemia. ঠিক আছে? That leads to increased risk of myocardial infarction. ঠিক আছে? Contraindicated in coronary artery disease. Other ADR like paresthesia, muscle weakness. ঠিক আছে? Sumatriptan comes as a short note. Sumatriptan mechanism of action comes in as a question. Learn triptans as well as Sumatriptan. ঠিক আছে? Triptan আর Sumatriptan ভালোভাবে জেনে রাখবি। কি বলবি? Then we come to ergot alkaloids. Now ergot alkaloids is derived from a fungus, Claviceps purpura. ঠিক আছে? So ergot alkaloids কোথায় কোথায় কাজ করে বল দীপশিকা, বল। 5HT তো কাজ করে, আর আলফা রিসেপ্টরস, এই আলফা রিসেপ্টরস পড়ানো হয়নি নিশ্চয়ই হয়েছে। তাহলে two drugs are used, ergotamine, dihydroergometrin. These are not being used, these are not very popular drug. Unlike the triptans, these are not very popular drug. So where are the ergot alkaloids used currently? Ergot alkaloids are used in postpartum bleed. Ergometrin is used in postpartum bleed. ঠিক আছে? Not very popular drug in migraine, but used in postpartum bleed, hemorrhage. Some say it's partial agonist, some say it's an agonist. So it has various degrees of agonism at 5HT, 1B, 1D receptor. So the same thing. ঠিক আছে? Like that of Triptans. But it has some obvious adverse reaction. Adverse reaction like nausea, vomiting. So in migraine there is already a tendency for vomiting, nausea and vomiting. ঠিক আছে? So it may aggravate the symptoms. Then uterine contraction. So in postpartum hemorrhage it is used for uterine contraction. So what will happen if the lady is pregnant? Abortion হয়ে যাবে, ঠিক আছে? There will be forceful contraction and expulsion of fetus. ঠিক আছে? Coronary vasoconstriction. So you must be careful in patient with myocardial ischemia. Contraindicated in coronary artery disease, peripheral vascular disease. Peripheral vascular disease? Huh? Name some peripheral vascular disease. Barger disease. Or peripheral vascular disease there is constriction of the peripheral vessels. This ergotamine may exacerbate this constriction. একেতেই রক্ত কম যাচ্ছে, further vasoconstriction that may lead to কি হবে ইস্কিমিয়া। ঠিক আছে? শ্বাস দেবা ওকে। NSAIDs. So paracetamol is not an NSAID, it's an analgesic. I have written in it. ঠিক আছে? Paracetamol is an analgesic. It's an analgesic. So what do you mean by NSAIDs? Mechanism of action of NSAIDs. COX-2. COX-2 is a selective COX-2 inhibitor. So NSAIDs are usually non-selective COX-2 inhibitor. There are selective COX-2 inhibitor. COX-2 and COX-1. Difference key? What is the difference between COX-2 and COX-1? Sachdeva? ঠিক আছে? COX-2 is responsible for inflammatory process, and COX-1 is responsible for the normal physiological process of the body. In কোথায়? কোথায়? In stomach, in kidney. ঠিক আছে? সব জায়গায়। ঠিক আছে? So ডিক্লোফেনাক, ন্যাপ্রক্সেন, অ্যাসপিরিন। So অ্যাসপিরিন কোথায় ইউজ হয়? হ্যাঁ হ্যাঁ ঠিক আছে। So aspirin is used as an antiplatelet drug. ঠিক আছে। So what will happen if platelets are opposed? Bleeding tendency. ঠিক আছে। So বুঝতে পারছিস? Paracetamol mechanism of action. এই ভালো করে পড়বি। হ্যাঁ আরে ছিল তো রে বাবা, তো সারা জীবন ধরে লিখতে হবে। ডাক্তারের প্রেসক্রিপশন লেখার সময় বলবি ফার্স্ট টায়ারে ছিল, তোকে জানতে হবে না? তুই আর কয়েকের মধ্যে তফাৎ কি থাকলো? So mechanism of action in this case, in case of migraine, inhibit prostaglandin and kinin release due to neurogenetic inflammation. It is effective in migraine without aura. In mild migraine, it is most effective. ঠিক আছে। First line of drug for migraine is NSAID, ibuprofen. ঠিক আছে। So ADR will be GI disturbance. কেন? হ্যাঁ ঠিক আছে। GI disturbance কি হয়? গ্যাস্ট্রিক আলসার হতে পারে, গ্যাস্ট্রিক ব্লিডিং হতে পারে। Then renal disturbance. কেন? COX-1 is being inhibited. COX-1 is responsible for the renal function, maintains renal function. ঠিক আছে। ব্লিডিং টেন্ডেন্সিস। Adjuvant means সঙ্গে দেওয়ার জন্য। ঠিক আছে। D2 ব্লকার, কিছু নাম বল D2 ব্লকারের। অনুশ্রীতি, D2 ব্লকারের নাম বল। মনে নেই? বাহ, কে বলবে? নুরুদ্দিন বল। কে বলবে? ডোমপেরিডন। ঠিক আছে। মেটোক্লোপ্রোমাইড। ঠিক আছে। These are all D2 blockers. So this dopamine has some role, is being hypothesized having some role in migraine. D2 blocker acts as an adjuvant. আর D2 blocker কেন দেওয়া হয়? অ্যান্টি-এমেটিক। ঠিক আছে। D2 blockers are anti-emetic. So D2 blocker reduce the symptoms of nausea and vomiting. Caffeine is also being used. So caffeine কিসে থাকে? চা, কফি। ঠিক আছে। So caffeine helps in the absorption of ergot alkaloids. ঠিক আছে। Also relieves the symptoms. So acute migraine, mild, moderate and severe. Mild এর জন্য প্যারাসিটামল, অ্যাসপিরিন, NSAID, antiemetic. Mild, called it mild when the headache is tolerated. Can be tolerated. Moderate, Triptans, chiefly Sumatriptan. The Sumatriptan has a very poor oral bioavailability. ঠিক আছে। Subcutaneous Sumatriptan has better bioavailability. বল bioavailability নাম কি? What is bioavailability? সব কিছুতে বসে থাকলে হবে? ঠিক আছে। ergot alkaloids and NSAIDs. Severe ranges from 12 to 24 hours. ঠিক আছে। So Sumatriptan, Rizatriptan, ergot alkaloids. In addition আর কি দেওয়া যাবে? হ্যাঁ, D2 blocker। ঠিক আছে। অ্যান্টি-এমেটিক হিসেবে কাজ করছে, প্লাস ডিজিজেও কিছু রিলিফ করছে। Sachdeva, are you getting it? So that was regarding acute attack. Acute attack hole attack terminate, we have to terminate the attack and give relief to the patient. Then there is prophylaxis to prevent further attack. There is a pharmacological prophylaxis, then there is a non-pharmacological prophylaxis. Non-pharmacological prophylaxis ki hote pare? Those who have photophobia, triggered by light, triggered by sound, those triggers should be avoided. Proper sleep, proper nutrition, ঠিক আছে, yoga, lifestyle modification, so that the trigger is not there. That is a non-pharmacological treatment, prophylaxis. That's not prophylaxis, non-pharmacological treatment. And then there is the prophylaxis. Now, how these drugs acts is not properly known. ঠিক আছে, কি propranolol, other beta blocker like metoprolol. ঠিক আছে, propranolol, one of the use of propranolol is prophylaxis of migraine. Propranolol comes as a short note. ঠিক আছে, uses of propranolol comes as a short note. Know propranolol very well. Then Amitriptyline, tricyclic antidepressant. Then flunarizine, calcium channel blocker. Valproate, topiramate. এটা কি? Valproate and topiramate anti-epileptic. ঠিক আছে, methyl sargite, cycloheptidine. Methyl sargite is an ergot alkaloid. ঠিক আছে, so these are used for prophylaxis. How they act as prophylaxis is a mystery, but they are very effective as prophylaxis. So non-pharmacological therapy, avoid trigger, lifestyle modification, yoga, proper sleep, proper diet. Now we come to the today's topic, P drug. P drug means preferred drug, priority drug, personal choice of drug. By personal drug, you mean which person? By personal, you mean personal choice of physician, not that of patient. So why is there a personal drug? You see, there are many drugs in your pharmacological textbook. All are not used with equal frequency. ঠিক আছে, so there are certain conditions, certain disease that you face more. So in such cases, it must be chosen by the physician certain drugs. The physician must be thorough with such drugs that whenever patient comes, you will be able to prescribe it with ease. Now in government hospital, if you go to a rural hospital, there are about 300 to 500 patients per day in outdoor. So such huge amount of patient has to be seen and prescribed drug, so that the prescription is faster and more efficient and beneficial to the patient. The physician must choose certain drug. It is his personal drug, his favorite drug. ঠিক আছে, it may vary. একজনের ড্রাগ, একজনের পার্সোনাল ড্রাগের সাথে আরেকজনের পার্সোনাল ড্রাগ may vary, but there must be some justification for that personal drug. ঠিক আছে, so these drugs are most familiar for clinician, practitioner, which are base priority, which includes name of the drug, dosage form, dosage schedule, duration of treatment. So if you are prescribing certain drug, say you are prescribing amoxicillin clavulanic acid, so you must be familiar with the formulation that has been used. Key formulation, tablet, dosage 625 mg, ঠিক আছে? How it is prescribed? Thrice daily for 5 days. You must be thorough with this thing, that these are the prescription details of amoxicillin. You must also know why the amoxicillin is being prescribed, the condition in which you are going to prescribe amoxicillin. You must also know what are the adverse drug reaction of amoxicillin. Well, adverse drug reaction amoxicillin. সবার প্রথমে ডায়রিয়া, হ্যাঁ? আচ্ছা, ডায়রিয়া তো কেন হয়? ডায়রিয়া কেন হয়? ব্লাড ফ্লোরা নষ্ট হয়ে যায়, ঠিক আছে? তো it's an penicillin, and any penicillin has propensity to cause hypersensitivity reaction, ঠিক আছে? So penicillin can cause hypersensitivity reaction. You must be even thorough with what ADR can occur. If there is ADR, there must be some remedy, ঠিক আছে? So you must be also thorough with that remedy. Key remedy কি? AD, hypersensitivity reaction, adrenaline, ঠিক আছে? You must thorough with that remedy. You must also know what are the drugs that may interact with that medication. So penicillin is my favorite drug. Sorry, amoxicillin is my favorite drug, and I know most data about that drug. That makes it a P drug of my choice. ঠিক আছে? লাস্ট বেঞ্চে অনুষ্ঠিত বসে কি করছে বাবা? So just as he was saying, there is another term known as personalized medicine. So this, who is this person? Who is this person? This is for patient, ঠিক আছে? Personalized medicine is for patient. So using individual genetic composition, doctor can choose a drug or modify its dosage to produce maximum therapeutic benefit and minimize chance of ADR. So it's a tailor-made drug. What do you mean by tailor-made? ঠিক আছে? So these are, suppose 625. This formulation is made using for male of 70 kg weight. Every male may not be 70 kg weight, ঠিক আছে? So you in a cloth shop you can get ready-made clothing. Some may fit you, some may be larger, some may be smaller. But if you go to a tailor, take the measurement and sew it, it will fit only and only you. ঠিক আছে? It's a tailor-made drug. So let's get an example. Isoniazid. Isoniazid is used for treatment of tuberculosis. Now for metabolism of isoniazid, there is acetylation in your body. Now there are two population, two types of individual. One is fast acetylator, one is slow acetylator. So what will happen if acetylation is done at a rapid pace? So if there is rapid acetylation, the concentration of drug will decrease very fast, ঠিক আছে? and if there is slow acetylation, a drug starts to accumulate in the body, causing neuropathy, hepatic toxicity. ঠিক আছে? So, two individual, one fast acetylation, one slow acetylation. So, if for fast acetylation, you can increase the dose of the drug so that blood concentration remains stable for prolonged time. For slow acetylation, you can lower the amount of drug or you can change dosage maybe one day after other, so that the chances of hepatotoxicity is low. That is known as personalized medicine, personalized for that person. You get it? Personalized medicine comes as a short note. Get it done. So P drug is not an universal drug. There will be variation depending upon doctors. My choice. Then countries, location, national formulary, essential medicine list. Some drugs are approved in certain countries, another drugs are not. Some drugs are present in certain localities. You prescribe a drug, patient fails to find it in any pharmacy. That is not good for patient. That must be present. Essential medicine. What is essential medicine? Essential medicine for a country has been specified. So, if you choose a drug from essential medicine list, the patient, it will be more helpful to the patient. National formulary means formulation, tablet, capsule, syrup. Cost. So, the patient must be able to afford the medicine. The medicine may be good, but if cost is too high, patient may not be able to afford it. কাজ হবে না. Culture. So suppose the patients are very much adherent to their prescribed drug. Or patient may be having workload, too much of workload. They are not able to adhere to the drug, to the prescribed drug. Suppose he is going to take medicine 4 times a day. So what will happen to the adherence? Miss হয়ে যাবে. So for that case, you must choose a drug that is, suppose it's taken 1 time daily. So that is more acceptable to the patient. Patient convenience must be taken care of. Availability. So the drug must be available in the market or pharmacy or online. The patient must be able to get access to that drug. To prescribe something the patient is not able to get, that is not desirable. Then guidelines. Suppose for malaria, for particular regions there are specific guidelines. তো কি হয়েছে? কিছু হয়নি. So there are specific guidelines. So in such cases you must choose from these guidelines. Suppose a region there is plasmodiums are resistant to chloroquine, and you get your P drug as chloroquine. ঠিক আছে, it won't be of any use. So there will be for that region, suppose in northeastern states, most of the parasites are chloroquine resistant. So for such states there are specific guidelines. ঠিক আছে, medicinal literature. So medicinal literature মানে journals, books. ঠিক আছে, then individual experience or interpretation. আমার দিয়ে খুব ভালো লেগেছে, I am giving to the patient and the outcome is fabulous. So that may be some individual bias for P-drug. So P-drug is not an universal something that everyone is going to have the same P-drug. It may differ from person to person, doctor to doctor. So why do we need an P-drug? Any guess? No. ঠিক আছে, first and foremost better patient outcome. ঠিক আছে, time saving, especially in setups where you have to look after large number of patients in very small time. ঠিক আছে, then knowledge of drugs, pharmacodynamics, kinetics, dosage, schedule, and ADR also, and drug interactions also. Better understanding of ADRs and drug interaction. ঠিক আছে, so let's come to the steps of choosing a P-drug. First, proper diagnosis of the disease, knowledge of pathophysiology. So why is diagnosis important? Because if your diagnosis is wrong, no medicine can treat it. Suppose a person is having depression, you are giving every antidepressant, but nothing is happening. You do a TSH, find out that his TSH is raised. So that person is suffering from hypothyroidism. Hypothyroidism manifests as depression. So what will be the treatment? Thyroid hormone. ঠিক আছে, thyroid hormone, not the antidepressant. Treatment is thyroid hormone. You bring TSH level, T3, T4 to physiological level and the depression will be gone. So getting a proper diagnosis is very important. First and foremost, the diagnosis must be proper. I suppose আছি বুঝছিস, টুপি খুলে গেছে না মাথায়। Then specify therapeutic objective. So when you are seeing a patient, you must specify the therapeutic objective. Suppose patient is suffering from malaria, we are going for radical cure. ঠিক আছে, radical cure means malaria হয়েছে না। So radical cure means, have you studied এই microbiology তে হয়নি, microbiology তে হয়নি। So radical, when there is a malaria, there is presence of parasites in your liver. ঠিক আছে, কি বলছিস? So there are presence of parasites in your liver. ঠিক আছে, there are presence of gametocytes in your blood. So these liver parasites of your liver may relapse after very long time. Gametocytes are used for transmission by mosquito. So for radical cure, you mean you must destroy the parasite in the liver for no future recurrence, and gametocyte to prevent transmission in the community. That is radical cure. Okay? So for malaria, we get radical cure. Supportive therapy. So there is nausea, vomiting. Yes, to give a supportive therapy. Palliative therapy. Palliative therapy is given for cancer. There is terminal cancer. You can do nothing about it. There is pain. So you can do something about the pain to stop that pain. That is, you can do that. You cannot save the patient, but you can treat the pain. That is the palliative therapy. Yes. So you must make sure what you want to do. Make an inventory of the effective group of drug. So all the drug that is effective in that condition, you must make a list. So the formulary is present, the guidelines available, and the availability in the market or the pharmacies. Choose an effective group according to criteria. So, efficacy. You must choose a drug that is efficacious, that is helpful in getting your objective. Whatever objective we have set, that will be helpful. Then safety. Safety, suppose a person is having hypersensitivity to penicillin. So you should not choose any drug that has penicillin, the structure of penicillin. Or a person is hypersensitivity to sulfur drug. So you must avoid any sulfur drug. That might cause hypersensitivity. Some certain drugs are nephrotoxic. If a patient is having renal issues, such drug must be avoided. Nephrotoxic drug, lithium, ঠিক আছে আর সবকিছু প্যারাসিটামল লিথিয়াম ঠিক আছে আর এনসেড ঠিক আছে এইমাত্র বলা হলো সবাই ফেস্টের পরে একেবারে ঘুমিয়ে পড়েছে convenience of the patient. Suppose the patient is a child, so he or she may not be able to swallow a tablet. In that case, the convenience is use a syrup. There is an oral drug and there is injectable drug. Which is more convenient? Oral drug. Suppose the patient is too much busy, too much of workload. There is some drug that is given once daily, some drugs that is given thrice daily. Which is convenient? Once daily. So you must choose accordingly. Convenient to the patient. And then there is cost. As per the capacity of the patient. Patient is okay in affording very expensive drug, and it's okay. But if patient is poor, cannot afford expensive drug, you must choose accordingly, even if it is more efficacious, ঠিক আছে, better drug, you must go for an alternative one. It depends. Choose a proper P drug. ঠিক আছে, from that group, earlier it was group, ঠিক আছে, now it is the individual drug. তাহলে drug what to choose? Active substance, dosage form, standard dose schedule, standard duration of treatment, ঠিক আছে, so everything comes under P drug. So let's schematic form, define diagnosis, specify therapeutic objectives, make inventory of the effective group of drug, choose an effective group, choose the P drug, ঠিক আছে. So let's have an example. 25-year-old lady having history of migraine, এখনই পড়া হয়েছে তাই তো, having a sudden onset of seeing aura. So what type of migraine? Classical, ঠিক আছে, followed by severe headache. Select an appropriate P drug as a physician for this condition. হ্যাঁ, ও কিছু বলেছে, অভিক কিছু বলেছে, বল বল সুমাট্রিপ্টান, বা সুমাট্রিপ্টান বললে তো হবে না, তার সাথে তার ডোজ বলতে হবে, তার ফর্মুলেশন বলতে হবে, তার ডিউরেশন অফ ট্রিটমেন্ট বলতে হবে, তাই তো. So diagnosis is acute attack of migraine. তাহলে অবজেক্টিভ কি হবে? টার্মিনেশন অফ অ্যাটাক and relief to the patient. That is my objective. This is an acute attack. We are not thinking about the prophylaxis. এখানে in this case our objective is termination of attack and relief to the patient, ঠিক আছে. Sorry, what option do we have? Triptans, ergot alkaloids, NSAIDs, ঠিক আছে. So it's a severe headache, ঠিক আছে. So what drug do we choose? Triptans. Then of all the triptans, most effective is Sumatriptan. তাহলে formulation is tablet Sumatriptan 50 mg stat, repeat if needed, ঠিক আছে. হ্যাঁ, স্ট্যাট মানে ইনস্ট্যান্টলি, ডু গেট ইট. তো ঘুমোচ্ছে, পরে পরে এসে ফলো আপ করবে, ঠিক আছে. তা আর কি দেওয়া যেতে পারে সুমাট্রিপ্টানের সাথে? হ্যাঁ, D2 NSAIDs দেওয়া যেতে পারে, ঠিক আছে, D2 দেওয়া যেতে পারে, ঠিক আছে. ডোমপেইড ওটাই তো D2, ঠিক আছে. কেস 2 এটা করবো না ছেড়ে দেবো? হ্যাঁ, পিপিটি বই দিদির কাছ থেকে নিই, ঠিক আছে. So 50 years old gentleman, IT professional, having heavy workload, irregular meals, history of episode of gastritis, presented with sudden onset of pain in right great toe at night, ঠিক আছে. Uric acid level was elevated, ঠিক আছে. So first the diagnosis. What is the diagnosis? Gout, ঠিক আছে. গাউটটা আগেই হয়ে যাওয়ার কথা ছিল, যাই হোক. Fine. So this is an acute attack of gout. ঠিক আছে? Then what is our objective? Termination of the acute attack. We are not going for decrease in the uric acid level of the patient. ঠিক আছে, ওটা পরে হবে। এখন ব্যথা করছে, what is our objective? Pain relief. ঠিক আছে? So what are the drugs we have? Colchicine, steroid, NSAIDs, selective COX-2 inhibitor. Colchicine is a very effective drug, but it has severe adverse effect. ঠিক আছে? Causes bloody diarrhea. Steroids, well, ADR adverse effect was immune suppression. ঠিক আছে? তো লং টার্ম স্টেরয়েডের জন্য ইউজ করা হয়। ঠিক আছে? স্টেরয়েড ক্যান বি গিভেন orally or it can be given as injection in the joint. Is that convenient? Huh? ADR. ঠিক আছে? Is that convenient? Giving an injection in the joint? ঠিক আছে? NSAIDs. The patient এর কি আছে? Frequent history of gastritis. ঠিক আছে? So non-selective COX inhibitor should be avoided. তাহলে বেঁচে কি থাকলো? COX-2 inhibitor, selective COX-2 inhibitor. তাহলে কি দিচ্ছি? Tablet. So formulation is tablet. Eterocoxib 120 mg stat and once daily. So the patient is having heavy workload. It is more convenient to the patient for 5 days. Then follow up. So eterocoxib cannot be given more than 8 days in a row. ঠিক আছে? Toxicity. Just selective COX-2 inhibitor.